Welcome to the Service Provider Podcast, where you get to hear mindful and soulful discussions surrounding guests' lived experiences, professional development, and impact of their culture and identity as they navigate daily life and things that just happen. I am your host, Frederick Morte, and before we get started, I just want to let you know that everything discussed here today are of our own thoughts, beliefs, and ideas, and they are not affiliated with any of our employers or any initiatives that we may be a part of. Also, keep in mind that this is not meant to be taken as therapeutic advice or any alternative to mental health treatment. So, without further ado, let me introduce our guest for today. So our guest today is Natalie Gutierrez, LMSW, and a current DSW student at University of Kentucky's Doctoral of Social Work program with a concentration in social work education. Natalie is a licensed psychotherapist specializing in trauma, EMDR therapy, CPTSD, grief, anxiety, women's health, BIPOC individuals, and LGBTQIA+ communities. Natalie proudly identifies as Dominican American. She is also the host of her own podcast called Tea Time, where she meets with other professionals in the mental health field and social work field to discuss topics important to the field. Natalie serves as a community advisory board member for the Healing and CPTSD Foundation, which is a nonprofit organization dedicated to providing resources, support, and community for individuals who have been impacted by trauma or are living with CPTSD. As a CAB member, Natalie helps to coordinate and host different live events and workshops and assists in the development of different resources for community members. Natalie received her master's in social work from Fordham University, Graduate School of Social Services, and her Bachelor of Arts in Psychology from SUNY College at Old Westbury. Welcome, Natalie, my fellow Dominican. Que lo que, how are you?
Hello, que lo que. Thank you so much for having me. Yes, fellow Dominican social worker here. Very proud. Thank you for the invitation to be on your podcast. It is an honor to be here. It's been a while since I've been a guest on a podcast, so it's nice to be on this side of it. I'm really honored and excited to be here.
Well, thank you for joining. I'm super excited and nervous in a way because you were one of the reasons why I finally got up and set up my podcast and just started doing it. So, first of all, thank you for helping with that. And also thank you for coming again. So Natalie, just tell us a little bit about you. I know I kind of just went into this really long spiel of your job, your background, but who are you? What do you do?
Yes, thank you for that wonderful introduction. I am Natalie. I am a licensed social worker. I graduated from Fordham School of Social Work 2 years ago. Time is flying. I cannot believe it. I've been working as a psychotherapist. And like you mentioned, I work predominantly with individuals living with trauma, CPTSD, work with a lot of clients that have anxiety. I work with a lot of BIPOC individuals as well. I work with a lot of people within the LGBTQ community, and that's kind of been my passion is working with these communities. I'm also a doctoral student, so this girl is tired all the time. I'm a DSW candidate at the University of Kentucky's social work DSW program. That is an online program, and it's had its challenges, of course, as someone I openly share my podcasts and my platforms that I do live with ADHD. So being in an online program can be difficult sometimes, but it's also helped me navigate being a full-time professional and working and going to school, having an online program. And I'm currently in the social work education track. Because I'm really interested in kind of transitioning into working within social work higher education, especially in kind of the diversity, equity, and inclusion space, and making sure that we can bring more BIPOC social workers into the field, and also improving the field practicum kind of process, because that is a process that I feel is very flawed within social work schools. And in a way, it's kind of just capitalizing off of our labor for free. And there's just so many things wrong there that I kind of want to step in and really improve like higher education within social work. So that was kind of the driving factor in going to be a DSW student. But outside of social work, I am a creative. I just like to make things. I am, a daughter, a sister. I have lots of different identities outside of social work, and ensure to also just practice self-care and not let myself get kind of like lost in the work that I'm doing.
Wow. Like, wow. That is all I can say. Those are all amazing things. I mean, it's inspired. You talked about your DSW program.
And looking to go back for my doctorate, I really did lots of research. I was initially open to like either a PhD or a DSW. And I was like, maybe I could go back to Fordham and do their PhD program. But then I kind of like really took inventory about what it was that I want like career-wise. And really where I see myself is working in like that higher education space, not necessarily as like an academic who's publishing research. I do want to teach, but not kind of publish research. While I love like reading and staying up to date with research around like evidence-based practices and innovations within our field, I'm not necessarily someone who's super passionate about like producing research full time. So I think that was a big kind of shift onto why I started leaning more towards the DSW, is it's more of like a practice-focused degree where the PhD is very like academic research-focused. And then there was also the time commitment. I was like, do I really want to go to school for 4 more years? I was like, I don't think I can. And to be honest with myself, I was like, after the 2 years of the MSW, I went in straight from my 4 years of going for my bachelor's. I was like, do I have the stamina while working full time to be in school for 4 years? And I had to answer that honestly, and it was no. I don't think I could do school for 4 years. The DSW program I'm in is 2 years, including like summers, and I was like, this is a little more doable for me. And then also like I'm not a good test taker, so I knew that like in a PhD program, the comp examinations would probably be a huge kind of barrier for me. So I kind of went with the DSW because I knew it would set me up for success a little more and was kind of more realistic and reasonable for my professional and personal like lifestyle at this point.
I mean, you bring up a good point. I think a lot of times social work students are told that they need to produce or to do. And a lot of times they do, right? They do it and there's this like sense of hustle, but a lot of times they're not doing it because they're really passionate about it, right? They end up coming to a point in their life where they're like, what am I doing? Like, what is this? Like, let me change and do something I actually want. And by that time, either they've already put a few years into another path. So, I mean, kudos to you for like really sitting down with that and like, answering really hard questions about yourself and just like how you be most successful. So you talked about practicum and wanting to be in academia and kind of like shaped that in a way. Do you have any impactful experiences while you were in your MSW program doing your internships?
Oh, I'm about to be transparent here. Transparency is really important. That's how we improve systems that are not working. So I'm not going to name the school, but I actually started off at another MSW program and transferred my second year to Fordham. And a large part of that was because of the practicum experience. A lot of my peers were being talked down on by staff within the practicum office. A lot of peers, including myself, we were told to quit our full-time jobs because it was not realistic for us to find a placement with our full-time job schedule. And we were all like, well, we need to work full-time. We can't make less money. So just that kind of like the assumption that people come from like enough privilege to have to like leave their jobs. We were really frustrated with that. It was kind of like this negative connotation always, like if you work full-time, like don't expect to have a good internship experience or for us to help you find an internship. A lot of us would end up researching independently, like internship sites, because they were just trying to hand us any agency that didn't necessarily align with like our values and career goals. So for example, while I was going for my MSW, I was working full-time at a nonprofit. So I already had nonprofit experience and like case management experience. And for my second year, they were trying to give me an internship that was more case management experience. So I was like, this really doesn't align with what I want to do moving forward. I would like to be a clinician, or I would like to do just something else and get exposure because I already work full-time in nonprofit. So I was really pushed into that one placement, and they weren't flexible and didn't want to give me other options. So that's when I was like, I'm going to look at other schools and transfer out of here because you guys are not. Yeah, I was like, this is, y'all not going to force me to do an internship that I don't want to do, that I already have experience in, and then make me pay for my tuition. And also I'm providing them free labor. We're not doing that. And that's just like one of many stories of people who had really bad experiences with field placement. And it's just a hustle. I think the whole system itself is flawed because we are providing like free labor. We are doing this on top of our other responsibilities. And so if we are providing this kind of benefit and resource to other agencies that really need us social work interns, we should at least be treated with respect, and our goals and like what we want from these places should at least be considered. So that's where I want to come in and make it a better like experience overall for students and really get them placements that, you know, align with their career goals and their mission as social workers. And I know like a lot of schools have been updating their policy and lowering the hour requirements because they are seeing like we're asking for a lot of free labor from our students along with everything else that they have going on within their lives. So yeah, I'm hoping for a better system in terms of field placement.
No, yeah, that is needed. I recall like my entire MSW program, every sidebar conversation was always about the practicum. Oh, the internship, whether it's something that didn't work out, someone has to leave, now they have to find another one. They wanted a specific program, but they're not allowing it. I mean, I know for me, when I started my program, you know, I didn't really start my program because I wanted to go into like clinical work, but my program was clinically focused, right? My second year, I found an internship with an organization that would allow me to work more in like macro social work. But my program didn't accept it, even though I had already like 2 years plus of like direct service work outside of like my internship and then another year with an internship. It was like, no, we can't accept you doing this. And it was like, oh, it was heartbreaking because it was like, you know, I really wanted this. You know, we want to utilize that time to really like buff up our resume. So when we get out to the field, we can say, you know, we can do the thing that we want to do instead of like having to start over from like scratch in a way. So that's great. I mean, I applaud you for wanting to go back into academia and really like fix that or, you know, adapt it for, you know, BIPOC and other individuals who might not have the best experiences. You also talked about the hustle, and I know I mentioned it earlier too, but you're a hustler, right? You're doing your podcasts, you're working. I think you have like 2 jobs. You're on a board. You go to like a bunch of different events related to like social work. How do you do it? How do you manage all of that?
Oh man, do I manage it? That is the real question. I'm kidding. I think a lot of it is like I just engage in these things because they align with like my passion and what I want to do. I feel like if I was just running around doing these things to like fill up a resume or connect or further like network or build connections, I think that would make it not as fun and enjoyable as these things have been. But I really like to go places that align with like what I really love to do as a social worker. So for example, the Latino Social Work Coalition Gala, I was there, I was having a great time because this is an organization that's really on the ground, like providing scholarships for Latino students to go pursue their MSWs. So I love to go places and participate in projects and work that really like aligns with what I love to do. That way I feel like my cup is full and not like I'm burning myself out. But with that also comes like really checking in with myself and setting boundaries. So I have vowed to not take on any more projects for the rest of like 2024, like engagements. I just need to relax and like focus on school. The Latinx and Social Work Volume 3 is coming out, and I'm going to be a part of that book, which I'm really excited for. So I just want to enjoy kind of the ride of like the book coming out and just focus on school. So I would say like managing it is constantly checking in with myself and saying like, how are you feeling? Are you doing too much? Do we need to step back from some things? And making sure I'm not doing things just for the sake of doing them, doing things that really make my cup feel full and that align with my values and what I want to kind of accomplish in the social work fields.
You're managing it. I wanted to touch base on the book, but before I do, in my little research of Natalie Gutierrez, I found like this article of you where you identified yourself as an anxious Latina therapist. And I just wanted you to talk a little bit more about what it's like for you, dealing or managing your symptoms associated with ADHD. What does your work look like?
So ADHD has been a part of my life since I was a child. I was diagnosed back when it was still ADD, and I was like 5 or 6 years old. I was presenting as just very like hyperactive and really like just disruptive in the classroom, which is hard to believe now. People are like, really? You were like disruptive in a classroom? Yeah, I was. It was the ADHD. And, unfortunately, my parents, like, they went and got me support in, like, the form of therapy, but they weren't really here for, like, medicating me as a kid, which I get now. Like, I think those are very, like, powerful medications. And I'm still making my own decisions around that and kind of figuring out if that's a pathway I want to take as well. But it is really, really challenging navigating life with, like, ADHD. I have like passion and creativity, but sometimes my executive functioning skills are just not there to help me delegate everything that I'm doing. And sometimes I do forget, like, I had a paper due and like I forgot the exact due date or whatever it is. Like, it happens. It really does. So it's been hard because sometimes I feel behind from my peers because I struggle with these skills that seem so basic to other people, like scheduling, maintaining organization, managing deadlines, things like that. I really struggle with because of my ADHD. So I feel really bad about it a lot of the time. And I feel like sometimes I'm like, is a doctoral program even right for me because of the struggle with like organization? Is an online program right for me? And it can get exhausting having to put in like additional energy to stay organized, to stay on top of things. But also in a lot of ways, it is one of my greatest strengths. I've had to be very academically resilient because of it. There's times in like grade school, like first grade, where I was at the brink of like getting held back and people wouldn't know that. But it's pushed me to really be resilient. It is the reason why I'm so creative and like to engage in like creative passions and things like that. So yeah, I always try to remember like the positive sides of it too. And just give myself lots of grace and understanding that it sometimes will take extra support and extra steps for me to do certain things.
I think it's really impactful to hear that, although you didn't get medication as a child, like your parents did seek out support. And I know in the Latino community, there's still a huge stigma surrounding mental health. And I see it every day when I work with the Latino community, like the comments. Like, I will say, however, like I have seen a lot more Latino families like going out to get services. I don't know what the reason exactly is. It's like reassuring that, the social workers that came before us have been doing really impactful work.
My parents are so traditional, yet not traditional at the same time. It's an interesting thing, but yeah, I'm really grateful that they were never shying away from like getting me therapy and support for mental health and kind of advocating for that. They may not understand it to its fullest, but they are totally open to like getting that support. And I talk to them about being in therapy all the time and the work I do. and they really like respect and appreciate like social work. So it's great.
So, some of your patients have described you as going above and beyond to provide excellent care for them. Can you just share some of the things like that you might do in session or that you might do in general for like your patients, or how do you work with them?
Yeah, so I just feel like with my clients, it is their space and they know that they can come in with whatever they want to come with in a certain session. So I have clients where they're like, okay, this is where I want to begin today. And, I just try my best to be intentional and like create the safest space possible for my clients. And I think that shows and that they're able to like talk about things that they're not talking about with other people in their life. And they feel like they could really bring anything into the therapeutic space and we can process it together. I think also just like normalizing the things that clients are going through is so powerful and it's kind of like underrated in like therapy. For example, like a client who was feeling lots of like shame and stigma around like OCD behaviors, normalizing that and just talking about it was so powerful. And when you provide that like psychoeducation and fill in the gaps for clients, it could be really helpful because they'll be like, I didn't know that or I didn't think about it that way until you mentioned it. So I think just like validating, supporting, letting clients lead the way and following them and meeting them where they are really good ways of like creating a safe space for them. And then just like my clients tend to like just be individuals who've lived with lots of trauma. And so I think a lot of the times when my supervisor actually said that clients will find you and sometimes it'll just work in this way where it's like things that you're currently like healing from or working through. You'll notice that clients are gravitating towards you and they're also healing through and working through those things. So it's like the clients that need you will find you. And that's what I've kind of noticed and seen. So I always feel like the right therapist for my people as well. And that always helps too.
That is really good advice from your supervisor. I mean, you mentioned what I wanted to talk about next. I know in every social work program, all social workers should know this. You should meet your clients where they're at. And for me, when I was hearing this all throughout my MSW program, I was like, duh, like, yeah, like we should like do this. But actually putting that into practice was really hard for me to grasp. I think there's a misconception a lot of the times from both sides in terms of like patients and the social worker, what providing a service is. So the social worker will look at it like, I'm trying to help, I want to improve, I want to change, I want to adapt this or this from this person. And the patient will come in like, I need help. Like, give me the tools, give me the stuff and tell me what to do. But really what the work is about is the patient and like just being there for them and like really navigating what comes up for them. I know one of my supervisor has always told me and reminds me, you have to follow the story. Like, what's the story of the day? Like, you come into session like, okay, just follow the story. Our supervisors even shape the work that we do with our patients.
That's one of the main things my supervisor has been talking about lately is like, don't jump to have to like feel like fixing things or anything. A lot of the time, my clients are like, I've never felt seen, safe, or like I could just be my authentic self in front of another person. So a lot of clients, when they're sharing like their things that they're going through, their trauma, they're just looking to be sometimes seen, heard, and like validated, and not necessarily for someone to jump in to save them and give them a solution. Our clients have their innate resilience and their strength, and we don't have to jump in to save them. There's a lot of power in just like seeing them for who they are, like you said, following the story, and then like naturally you'll jump into like providing tools and building off of the tools as well that they already have, because all of our clients are coming in with their own tools.
Talked about CPTSD a little bit in the beginning, but for those who do not know, what is it?
CPTSD stands for complex post-traumatic stress disorder, and it could sometimes be interchanged between complex and chronic, but it is a mental health condition, that can be developed after exposure or experiencing like prolonged or repeated trauma. So some examples of that can look like domestic violence, where in an abusive relationship, there's oftentimes multiple incidents or occurrences of abuse. Childhood neglect or abuse that happens over like a span of time, being exposed to war, genocide, different traumatic events such as that. Being a veteran, a lot of veterans struggle with CPTSD. And the main difference between that and PTSD is that like chronic exposure to prolonged or trauma that has happened over time. And that comes with more difficulty with regulating your own emotions. A lot of people with CPTSD also struggle with relationships and day-to-day functioning, and a lot of interpersonal difficulties as well. After experiencing prolonged trauma, it could really break your trust in people. It could change your perception of the world and just your worldview. So a lot of people with CPTSD may struggle with having like a negative perception of their self or the world and the people within it. And then similarly to PTSD, there's those other symptoms such as like re-experiencing or having flashbacks, avoiding people, places, and things that remind you of the trauma, and that kind of hypervigilance of kind of feeling on edge, or maybe being kind of triggered by certain things in your environment, certain sounds, noises, smells. So I think with CPTSD, that's something a lot of my clients are coming with, whether it's from domestic violence or like child abuse. There's also clients out there who have gone through like human trafficking or sex trafficking, or people who've been exposed to community violence as well, or grew up in communities that had a lot of gun violence, gang violence. So there's a lot of different things that fall under that kind of diagnosis of CPTSD.
And just hearing you like describe this, I'm pretty sure that sessions can have a lasting effect on, on the patients, but also on you or the therapist working with these individuals. How do you specifically like take care of yourself or your mental health, having to deal with this population and really managing and assisting them through this process?
I said earlier, like sometimes we get into things because we personally experience them. So for me, like being in my own therapy has been number one, and like managing being like triggered by any things that come up with clients or like hearing their trauma stories. I do EMDR therapy as well, which is an intensive trauma treatment modality that utilizes like bilateral stimulation while reprocessing like traumatic images, and that helps to kind of like reduce the disturbance related to those memories. So I'm quite literally pulling with clients, like, let's think of this traumatic image. And while you think of that and like the negative beliefs you've developed about yourself, moving your eyes back and forth or engaging in tapping, and they can have like reactions to that and start crying or start feeling very triggered or dysregulated. And as a therapist, you have to help them stay contained and stay regulated, while also like, after the session, sitting with that too and like hearing all the trauma and all those things. So what I try to do is actually like there's this tool in EMDR called Container, where you guide your clients to like take everything we did in the session for that day through like a guided meditation and have them like kind of picture putting them all that stuff in a container and closing it safely up until like the next session. So I'm right there with them. Like once my client is done with their session, I'm using Container and I'm saying whatever we just processed in the session, I'm going to put it in a container, keep it safe. And if it's something that resonated strongly with me or kind of made me feel something, I'm going to process that when I have my own therapy session, or maybe even in supervision too, because we can talk about things like vicarious trauma or countertransference and transference, all those things we can discuss and process too with our supervisors.
I always say the best therapists are those who practice what they preach. I think that allows patients to really connect with them, instead of feeling like they're being talked at or told like this is what you should do and then kind of like, okay, moving past it. Like really working with someone who talks about and knows their stuff, but also practices that. I imagine that could be very powerful, and the patients probably resonate with you more because of that.
Absolutely. Yeah. Like I went to get certified for EMDR and trained in it because it's a modality that I used for my own healing. So I do everything and I practice these things as well. And they're modalities and things that I truly believe in and feel are effective. So I'm able to like share, I don't disclose with my clients, of course, my trauma history that I've done EMDR, but they can tell that it's a modality that I fully believe would be beneficial for them. And I kind of like guide them through that and make sure it's a safe, productive experience for them too. So absolutely, it is super important.
Keeping with container, right? You're gonna put some of these thoughts that may have come up and put them away so we can kind of transition. So talking about the book. What is this book? How did this book happen?
So Latinx in Social Work is a collection of personal narratives from different social workers in the field that identify as Latino or Latinx. So this book kind of came about a year ago. I was approached with the opportunity and from my mentor, who her name is Dr. Jessica Hardial. She's an LCSW. She's Dominican and Ecuadorian. Also went to Fordham. So she approached me with this and offered to be my madrina, which is basically like a mentor in the social work field. And I was freaking out. I was like, she wants to be my madrina. This lady has like a private practice, a PhD, LCSW, a very accomplished woman wants to like mentor me and take me on. So I had to say yes, of course, like book aside, story aside, just like the opportunity to be mentored by someone that I had already been inspired by and kind of resonated with their work so much was incredible. So shout out to her because she's opening doors for a lot of other social workers. But it's been a wonderful journey, like meeting other people through that collective. The book comes out December 6th. I'm really nervous because I kind of put it all out there in my personal narrative. So I'm nervous about how it'll be like received, especially like by family members who will definitely be reading the book. But I think like it's definitely been one of the bravest things that I've ever done for myself, just like candidly tell my story. And I'm really excited for people to read it and see a kind of like a different part of me. People see like the professional side, the podcaster, but it's really just like me and my story in the rawest form. So I'm nervous, but also excited. And we'll see like what happens from there. And, we'll come next with this new journey.
It's so exciting. I mean, you're talking about being in an MSW program, graduating, and then going to your DSW program, doing all these things, being a part of events, book.
Yes.
And talking about your madrina, what I've seen a lot of social work students tend to not connect with their professors to a level where they become their mentors. It's kind of like they do their MSW program and it's like, okay, I graduated, move on. I think there's a sense of like unity and power with connecting and networking with all kinds of social workers, even if you're not doing relatively the same things, because they could always connect you to someone who is. So how has mentorship like guided the work that you've been doing and hopefully where you're going next?
I was really lucky within my MSW program that professors were really just like hands-on, and I did ask some of them to write my references for my DSW program and some of my previous supervisors as well. So professors have served as mentors for me. They were really always available when I was at Fordham after class to support. They made themselves available to support me in applying to DSW programs. They also talked to me about their own experiences as doctoral students. Then with my mother, Jessica, she really helped me in the process of like writing the chapter, as that's something that she's already done. And providing support there. And she's always just checking in with me and saying like, how are you doing? And like I mentioned, she's someone who has a practice and she's just been opening up lots of doors for other social workers too and having them work at her practice. And then like former supervisors too. So I have a former supervisor when I was working in a school setting. Her name is Dr. Selena Bravo. She has been a mentor to me as well. She has written reference letters for jobs without hesitation, wrote my reference letter as well for my doctoral program. And it has been like just a supportive advocate for me, has been on my podcast. So mentorship has been everything to me. And whenever I am ready and in the space, I will mentor others. Because like it's really shaped my career so far. So I want to pay it forward and help mentor others. And I think part of wanting to be working within education and working within field and practicum is also that piece of really wanting to mentor other social workers and give them a good experience before they kind of head into the field, because it is chaotic and crazy sometimes, like in this field. So the more we could protect and guide our social workers, the better the outcomes for them and the field as a whole.
Just hearing what you're saying is taking me back to some of the experiences I had in my MSW program. And I did some research again, in terms of like, what advice you might give social workers, people who might be thinking about social work, going to an MSW program. I wanted to ask you again here and see if there's anything new that you might suggest to anyone who might be interested.
Yeah, if you're thinking of doing social work, know that there is so much to do in this field. I think a lot of people head towards clinical work and kind of like that's the space that is pushed a lot in a lot of the programs, and a lot of programs have like a clinical focus. But really don't be afraid to try other things in social work. I know people who work as forensic social workers, hospital social workers, school social workers. There's people using their degrees to work in higher education. So really like the sky is the limit. Going into social work doesn't mean you're going to work taking people's kids or just being a therapist. There's so much more than what it's portrayed to be. So I would say come into it with an open mind, and the possibilities really are endless. Take care of yourself from the moment that you start graduate school. I would say find your community as well. There are so many great supportive people in this field. And just like shooting a message to someone, you'd be surprised by the response that you will get. I've never once messaged another social worker with like a question, support, or asking for help with something and been told like, no, we're not gotten a response. Everyone is so welcoming in this field and willing to help. So definitely, like, I'm biased, but go for it. It's a wonderful profession with a beautiful community, and there's really so much that you could do. And embrace the hard too. And that's where like your community comes in to support you. Like we have to normalize and talk about how it is a hard job to do, a hard profession to be in. We do need to pay our social workers more. But I feel that it's such rewarding work. And, I'm here as a support for anyone who ever wants to DM or message me on Instagram to discuss social work, what it's looked like. I'm happy to be a resource in that way.
Look at that, already attempting to mentor other people. That is great stuff. I mean, before we end for today, I know we talked a little bit about the podcast, some of the things you do creatively, but I really wanted to dig a little bit deeper in terms of that, because my entire area within social work, I would say, encompasses creativity and the arts. So my background is in theater and performance, specifically. So even throughout my MSW program, I always found creative ways to kind of like mix and merge the two. So I wanted to ask you, like, how do you stay actively creative in this profession that can at times seem overwhelming or daunting or bring up real life?
I love creativity. It's honestly everything to me. Behind me, I have paintings that I've done. I will paint like I don't care if we're virtual. I'll be like, with my clients, let's paint together how that's feeling. Let's draw together. I have clients journal in sessions with me, and like we could do poetry and things like that. So it's something I like to encourage within like therapy, but I also love to do it in my own personal life too. So the podcast has been like a huge outlet for me. I have wonderful guests come on, and I get to really like dive into the work that they're doing. And, you know, when you create a podcast, like it's about the content, but you're also doing marketing. You're creating kind of like this brand for yourself and your podcast. So I've had so much fun making like little cute graphics for my podcast. And like, I made a t-shirt the other day. I was like, look at me. So there's so much to do there. And I'm just really having a good time with it. And I need that as part of like my work and my passion, because I hate doing notes. I hate paperwork. Back-to-back sessions, a long day can be a lot. So I need to keep kind of like creative and find other outlets for myself as well.
I think it's super important to find other things to do besides social work or outside of social work, because like we talked about, right, there's a hustle in social work where a lot of times you can find yourself having like things due that you didn't know were due, or like all this work, and you're like, oh, when am I gonna go on my next vacation, or am I gonna just enjoy some time? And it's like, we gotta schedule those things. You have to be intentional about those things. There's a lot of social workers who deal with burnout don't want to see social workers leave the profession. We want them to stay. We need social workers.
No, absolutely. And I will say, like, the podcast in particular, I was always someone who was not really comfortable with using their own voice for a lot of time. In like grad school, I was so quiet. So people are probably like super surprised now that I have like a podcast and stuff, because I was so quiet. And part of it was like the dynamics of like graduate school. And one of the things that came up a lot is how much like space the white students were taking up in class versus the BIPOC students. But having my own podcast has helped me find my own voice, have a platform, been able to raise awareness about issues that are really important to me. So it's also a means of like creating and developing your own voice in this profession too. So I would always encourage a social worker, anyone in the mental health field, like get on a podcast and start it, or start it with a friend or someone. Start your podcast. The world needs more voices that are social workers. We need to center more voices that are BIPOC, people of color, people who are LGBTQ, marginalized communities. We need to center our voices and have platforms. So I think this is incredible. And I'm really happy to see that you have a podcast. I'm excited to see my other friends coming up with podcasts. There's room for all of us here, and I cannot wait to see how this continues to flourish and grow.
Thank you again for our conversations, for pushing me to take that leap, to start recording, start doing this, start the podcast. But also just thank you for coming on, for willing to have a conversation with me, talk with me. I was so excited to have you on today. And before I go into the outro, I just wanted to ask, is there anything you want to mention before you head out, or anything that you might want to clarify?
Yeah. First, thank you again for having me and for the invitation to be on your podcast. Secondly, it is Domestic Violence Awareness Month as we are recording this in October. I am involved with the Healing and CPTSD Foundation, and we have resources and support available through our community for individuals who've lived and experienced domestic violence. On my own platform, which is at Healing Corner with Nat on Instagram, I'm going to be going live with one of my closest friends who's also a social worker. We're going to be talking about domestic violence, sharing resources, and kind of just talking about the stigma and the myths around domestic violence. I will be doing a live Q&A as well, so you can go on my page to find more information on that. And you can also find ways to stay connected with me and reach out if you have any questions about the field of social work through there as well.
You've already said it, so please stay connected. She's giving you all the details. You have all the information to do so. So, Ali, thank you for joining me. I am so glad that we were able to meet today and record today's podcast. Thank you, everyone, for listening. I will let you go for today. And if you like this episode, please like, subscribe, share to a friend, share to someone who's asking questions about an MSW program, social work school, or any type of mental health service and wants to know a little bit of what some therapists might think. Thank you for listening to the Service Provider Podcast. I am your host, Frederick Marte, and I just want to say, have a great day. Please, please, please follow me on Instagram to connect at Frederick Talks. And you can listen to the podcast on Spotify as well as Apple Podcasts.